Welcome back. Just imagine recovering from a serious illness only to find out you have possibly long-term side effects. That's exactly what's happening to some COVID-19 patients. But now, Jersey Matters' Sherry Karabin tells us there's a brand new center for treatment in New Jersey. Sherry.
Thanks, Larry. For some COVID-19 patients, recovering from the virus is just the beginning of their stories, since there can be serious and lingering side effects, including fatigue, lung and heart problems. Now, residents in need of aftercare can visit Hackensack Meridian Health's new COVID Recovery Center.
We had a tremendous amount of patients, seen by us or not seen by us, that needed continuous medical care after having had COVID. And a lot of those people weren't actually getting into where they need to go specifically.
Hackensack Meridian Health Senior Vice President Dr. James Clark is talking about the reasons the institution decided to start a COVID recovery center. Opening in mid-July, the center is designed to provide medical support and assistance to the hundreds of thousands of recovered COVID-19 patients living in New Jersey and the surrounding tri-state area.
We felt that we could offer clinical care to the patients. They could help perhaps contribute to research, and as different treatments or knowledge evolves, we can readily bring that to our community.
Based in Bergen County, the center connects patients suffering from post-COVID-19 symptoms and conditions to primary care doctors and specialists located throughout the Garden State.
Patients who may have particular concerns with ongoing symptoms can reach our phone line, our telephone line, and the staff will then direct the patient to one of the physicians who are participating as members of the recovery center. The physician then has a either in-person visit or a telemedicine visit with the patient, and then determines based on their symptoms what would be the next appropriate step of care.
Over the last few weeks, the center has seen more than 20 patients, with many others making appointments. Patients range in age from those in their 30s to 70s. Symptoms, too, run the gamut from mild to severe, with many presenting with pulmonary or lung problems and cardiac conditions such as heart rhythm disorders. Common complaints include fatigue, dizziness, shortness of breath, cough, and chest pain. Others contact the center because of behavioral health concerns like anxiety and depression.
Behavioral health jumped out more than even I thought it would. It's the third on the list of consults that we get required. Cardiology and pulmonology kind of go back and forth, 1 and 2. And then behavioral health is number 3.
While there's no way to predict who will develop side effects from COVID-19, this primary care physician says there appears to be at least some relationship to the severity of the patient's illness.
Patients with very mild infections or who have infections and are asymptomatic may not have persistent symptoms. However, there may be patients who had a very severe illness who may be fortunate to not have active symptoms. Although we do seem to see a correlation between a fairly active state of infection and a form of persistent symptoms.
With so many unknowns about the virus and new symptoms continuing to be added to the list, doctors say if you aren't feeling well, the best advice is to get screened right away.
There are probably some syndromes that we just haven't characterized yet. Part of the reason to have a center, to see a number of people and get a sense of what is going on, and characterize their illness, see if we can identify the cause and work through new treatments.
You don't want to wait. It could be something that has nothing to do with COVID, which should be taken care of anyhow. But certainly getting screened on that telehealth visit to the appropriate people that can see you and determine is this post-COVID, or if it's not, they're still going to take care of the issue.
In Hackensack, this is Sherry Karabin reporting for Jersey Matters.
All right, thank you, Sherry. Still to come on Jersey Matters, another victim of COVID. One New Jersey school may have to shut down for good. We'll tell you where it is next.